Hi everyone, and welcome to my channel. I'm excited to share my content with you, and I hope you enjoy watching. Don't forget to like, comment, and subscribe to stay updated on my latest videos. Let's get started. In this video we are going to see about early liver disease symptoms in alcoholics and non-alcoholics. Early liver disease symptoms can be similar in both alcoholics and non-alcoholics, but the underlying causes of liver disease may differ. It's important to note that these symptoms can also be caused by other conditions, so it's important to see a doctor for proper diagnosis. Additionally, in alcoholics, liver disease is often caused by excessive alcohol consumption, which can damage the liver and lead to inflammation, alcoholic hepatitis, and fibrosis. In non-alcoholics, liver disease can be caused by a variety of factors, including viral hepatitis, autoimmune disorders, metabolic disorders, and certain medications. Understanding the early liver disease symptoms in alcoholics and non-alcoholics. The heart, brain, and lungs are probably the three organs that individuals would mention the most commonly if asked to pick the most crucial bodily organ. However, some doctors, like well-known physician Dr. Oz, believe that the liver is the most crucial organ. Given its capacity for detoxification, infection control, energy storage, and digestion, it is not surprising that the liver is ranked so highly by medical specialists. The ceaselessly active liver toils in the right upper quadrant of our belly, but because it makes no throbbing, pulsating, or breathy noises, it's simple to forget about it. In reality, unless there is a major illness, the liver rarely hurts. In order to receive prompt medical care and intervention, it is essential to be aware of the initial signs and symptoms of liver illness. Information on liver disease. The American Liver Foundation estimates that at least 10% of Americans suffer from a liver ailment. The American Liver Foundation also notes an increase in the incidence of hepatitis C, non-alcoholic fatty liver disease, and liver cancer. The top 3 risk factors for dying from liver disease are alcohol consumption, hepatitis viruses, and obesity. All 3 of these conditions are thought to be extremely preventable. Cancer, autoimmune conditions, genetic or metabolic problems, and other diseases are some more causes of liver damage. Unfortunately, many liver problems don't show any signs until there has been significant, and sometimes irreparable, damage. 69% of persons with cirrhosis were unaware they had liver disease, according to a population-based study. African Americans and Hispanic Americans are more likely than Caucasians to suffer liver illness, according to a different study. African Americans have a higher prevalence of obesity, diabetes, and hepatitis B or C, whereas Hispanic Americans have a higher risk due to increased drinking and a higher prevalence of obesity and diabetes. Non-alcoholic liver disease. When individuals discuss liver disorders or damage that isn't brought on by binge drinking, they typically mean non-alcoholic fatty liver disease, or NAFLD. The liver begins to accumulate extra fat as a result of this illness. NAFLD damage exhibits characteristics that are comparable to those of alcoholic liver disease. The most prevalent type of fatty liver is referred to as fatty liver and is a subset of non-alcoholic fatty liver disease. A fatty liver can be brought on by diabetes, high blood fat levels, and obesity. The majority of the time, fatty liver is asymptomatic and treatable with a change in lifestyle. Non-alcoholic steatohepatitis is a more severe form of NAFLD, NASH. In this syndrome, liver cell inflammation and variable degrees of organ scarring are linked to fat development. NASH is a dangerous illness that can cause cirrhosis and extensive liver damage. Alcoholic liver disease is known to cause jaundice, which is characterized by a yellowing of the skin and the whites of the eyes, as well as exhaustion and digestive problems. The following are less well-known indicators and symptoms of alcoholic liver disease. Skin disorders such as eczema, psoriasis, and itching. Negative effects of drugs like antibiotics or analgesics. Acid reflux and heartburn on a regular basis. Additionally, alcohol addicts may see considerable reductions in their alcohol tolerance and experience quicker onset of intoxication. As liver disease progresses, alcohol abusers may experience more severe hangovers than usual. The effects of alcohol on the body. Alcohol has perhaps the most significant effects on the human body, both emotionally and physically, despite being legal and socially accepted. The liver, pancreas, stomach, and esophagus are just a few of the several organs that alcohol has an impact on. Malnutrition and vitamin deficiencies, such as low thiamine, can result from alcohol usage. Wernicke-Korsakoff syndrome, sometimes known as wet brain, is a disorder that results in mental decline and is frequently characterized by low thiamine levels. The liver is particularly vulnerable to the potentially fatal effects of alcohol usage. A high level of bilirubin, which is responsible for the natural destruction of red blood cells, is present in many alcoholics. The degeneration of liver cells and cirrhosis, or liver scarring, are additional liver issues. Alcohol depresses the central nervous system and has negative effects on the liver, heart, and other organs. The most often abused substances that result in fatalities both during use and during detoxification and withdrawal are believed to be alcohol and benzodiazepines. It takes a lot of time to talk about and study how alcohol affects the person drinking it. Do its teratogenic consequences exist? An unborn fetus can have fetal alcohol syndrome when the mother drinks alcohol. The child may experience cognitive difficulties and maladaptive behaviors as a result of alcohol usage during pregnancy. Stages and early signs of alcoholic liver disease. 3 different forms of alcoholic liver disease are listed by the American Liver Foundation. These are alcoholic cirrhosis, alcoholic hepatitis, and alcoholic fatty liver disease, listed from most severe to least. These may share similar symptoms and indications. Alcoholic fatty liver disease. This condition develops when there is an accumulation of fat in the liver, which results in inflammation and impaired liver function. Even after only a brief period of frequent drinking, alcoholic fatty liver disease can develop. Although symptoms are not typically apparent at this stage, according to the American Liver Foundation, some people may experience weakness, weariness, or soreness in the right upper abdomen while the liver tissues are still being damaged. Drinkers can typically reverse liver damage at this stage by quitting drinking. If drinking is continued, liver damage won't go away and will eventually lead to irreparable disease. Jaundice. Excess bilirubin in the body causes jaundice, or the yellowing of the skin or eyes. The liver excretes bilirubin that the body creates as part of normal blood formation. Alcohol usage damages the liver, making it incapable of eliminating bilirubin, which causes the colored substance to accumulate in the body. Abdominal pain, flu-like symptoms, and exhaustion are further symptoms of jaundice. Although jaundice itself is not life-threatening, it frequently indicates a problem with the liver. Alcoholic hepatitis. This illness might appear after a sustained period of drinking. As a result of liver inflammation and scarring, vital functions are slowed and blood flow is restricted. Despite the possibility of a moderate diagnosis, alcoholic hepatitis is a dangerous disorder that necessitates abstinence from alcoholic beverages. Alcoholic hepatitis that is severe can be fatal. If untreated, it may develop into liver cirrhosis. Up to 20% of habitual drinkers might develop alcoholic steatohepatitis, a severe form of the disease that can cause lifelong damage and scarring. There may be no symptoms or indicators associated with the mildest forms of alcoholic hepatitis. Signs and symptoms of the illness could include fatigue, low-grade fever, jaundice, decrease in appetite, nausea, vomiting. The right upper abdomen feels tender. Loss of weight. Elevated liver enzyme levels can be found using liver function testing. Alcohol-related liver or renal failure as well as abdominal fluid buildup are possible consequences of severe hepatitis. You must immediately seek medical help and advice at this point. Alcoholic cirrhosis. Although abstaining from alcohol may stop future damage and lessen some signs and symptoms, the illness is irreversible. There is extensive liver scarring associated with this kind of liver disease. Alcoholism-related cirrhosis patients very probably depend on alcohol and need both medical care and a lot of assistance. The liver finds it challenging to adequately carry out its duties due to this scar tissue. A person with cirrhosis brought on by alcohol has a less than 50% probability of living for another 5 years if they continue to use alcohol. That's all for today's video. Thank you for watching, and I hope you enjoyed it. If you did, don't forget to like and leave a comment below. Also, make sure to hit the subscribe button to stay updated on my latest videos. Until next time, take care.